Hi there, and welcome to Learning the Ropes, a guide for new patients at the UC San Diego Parkinson and Other Movement Disorders Center. My name is Lisa, and I'll be your host today. Our team looks forward to meeting you, but in the meantime, I hope this presentation helps introduce you to our center. We intended this presentation for those who are new to the UCSD Parkinson and Other Movement Disorder Center, whether you are considering getting care with us, waiting for your first appointment, or have had an appointment and are just getting started. So we can be on the same page, I've created a list of our objectives today. I'd like to introduce you to our center and team, prepare you for your first visit or next visit, share some tips and tricks for navigating our healthcare system, and finally share some community resources. If you have any questions along the way, please jot them down. I'm happy to help get answers to you. I'll leave my contact information at the end of the presentation. Alright, now let's get started. To start with an introduction to our center, I think it's important to start with our purpose by way of a mission and vision statement. Our mission is to translate innovative research into state-of-the-art, comprehensive, personalized patient care within movement disorders. Speaking of translating, in simpler terms, we are here to deliver the latest and greatest to each of you in a tailored fashion. Our vision is to enhance the mind and body, one life at a time, through new science, new medicine, and new cures. In other words, we'll be at our best in order to offer opportunities for you to maximize your quality of life, both your physical health as well as the health of your mind and spirit. Fulfilling our purpose really starts with clinical excellence. With the backing of the large academic UC Health System, we have the ability to provide state-of-the-art care, fueled by the latest research in neurology, but also across all domains of health. The backbone of our center is an interdisciplinary approach that is able to address the whole person and the diversity of a movement disorder. Our expertise has been recognized with the prestigious designation as Center of Excellence, which I'll go more into depth about in a few minutes. Our center includes comprehensive surgical programs, and by comprehensive, I mean it includes an interdisciplinary approach for evaluation to ensure that this is the right fit, as well as ongoing management. You heard the term Center of Excellence a few minutes ago. We have been recognized for expertise in clinical care with the Center of Excellence designation. Well, we actually have this designation from 3 national organizations, including the Parkinson's Foundation, Lewy Body Dementia Association, and Cure PSP. And I'll just throw in that Cure PSP supports numerous prime-of-life diseases, including atypical Parkinsonism like PSP, CBD, and MSA. These designations each have a threshold to meet for clinical excellence, research endeavors, professional education, and community outreach programming. We really couldn't provide clinical care, education, and community outreach without an interdisciplinary team. This model of care is also integral in meeting our purpose of providing complete care for the body and mind. We've brought together professionals from a number of disciplines, all within UCSD Health, and we are the most comprehensive movement disorder clinic in San Diego County. These are some of the people that make up our interdisciplinary team. Your physician is a neurologist with additional training or fellowship in movement disorders. I think this is important to highlight because neurologists treat hundreds of diagnoses, while movement disorder specialists are very focused, allowing them to be the ultimate experts with care of Parkinson's and related disorders. Our physician team includes 7 movement disorder specialists, as well as 2 movement-trained nurse practitioners. We have a wonderful social work team, rehab team including physical and occupational therapists, and speech-language pathologists. Last but not least, we have neuropsychologists and clinical coordinators. It's safe to say our team has you covered. Our clinical team is largely based in La Jolla at our clinic located on Executive Drive near the UTC Mall. Our friends in rehab, research, and psychology are located down the road, also in La Jolla. Now, there may be times that your appointment location may vary, so please always confirm the location when scheduling. Now, that's enough about us. Let's talk about you and your experience at our center. Let's start with your first or next clinic visit. First things first, you'll call our clinic to schedule your first appointment. You'll find our phone number in the description box below this video. Our clinic team may ask that you have a referral place for insurance purposes. We'll also ask that you submit neurology-related medical records to us by fax ahead of time. Now, if you've had brain imaging complete, like an MRI or DAT scan, it's important for your doctor at UCSD to see the actual images versus a written report on paper. To do this, you would need to call the place where you had the imaging done and request the images on a CD. For safekeeping, it's best if you bring the CD with you to the appointment versus mailing ahead of time. During the times of a pandemic, we are also offering telemedicine or video visits. Typically, new patient appointments will need to be done in person because a physical exam is such an integral part of confirming a diagnosis. You can always ask our clinic if a telemedicine visit is an option in your particular case. I also want to address a point of potential frustration, and that is the time frame of your scheduled appointment. Most folks I speak with want their appointments as soon as possible, like yesterday. We typically have a few-month wait, and we know that this is far from ideal. We are working so hard on growing our team to accommodate, so please bear with us. In the meantime, I have a suggestion. Schedule the first available appointment and request that you be put on the wait list. Cancellations happen all the time, and our clinic team is regularly pulling people off the wait list for a sooner appointment. My hope for everyone is to get the most out of their healthcare, and I believe a large part of that is making the most of the clinic visit. Part of that prep is taken on by our clinical team, but the other part falls on the person seeking care. Here are a few tips we recommend to prepare for a clinic visit. First, and this is particularly important if you are visiting with us for the first time, is to create a timeline of the onset of symptoms, which is key for the movement disorder specialist to provide an accurate diagnosis. It's helpful if you're able to explain when each symptom started in relation to time. For example, I first noticed my right hand shaking when I was typing an email the year before I retired in this year. Next, my wife commented on my feet shuffling while we were on vacation in this month or year. Tip number 2. We suggest identifying the top concerns that you'd like addressed during the visit. Maybe there's a burning question about a new medication, or you're concerned that you're not able to fall asleep right away. You may also want to discuss this list with your partner or a close friend or family member. We want you to be satisfied after you leave the clinic and be in the driver's seat on what's covered during the visit. Speaking of a partner or a loved one, we also suggest bringing someone that knows you well to the visit. And this is for a few reasons, including note-taking, help with providing a history, and moral support. You may already be an expert healthcare navigator and use these tips, but we just wanted to share just in case. There are a few things to know about the clinic experience. UCSD Health as a whole is an academic medical center. As such, we train future healthcare professionals like medical students, residents, and fellows who may partake in the clinic visit. You will always be asked permission for a trainee to be present in the visit, and if you have specific preferences, please let our team at the front desk know. Many of our movement disorder specialists are also involved in research. We have many opportunities available, and the doctor may share relevant studies with you. And lastly, our social work team may also be present for your clinic visit. These days, most of our social work visits are completed virtually, but if you have a preference for an in-person visit, please let the clinic know before your appointment. At the clinic appointment, you'll meet with your doctor. They'll take a history and complete physical exam. At the end of the visit, they'll discuss the diagnosis and outline their recommendations. At checkout, there are a few steps that are very important. First, you'll receive a printout called an after-visit summary that includes the highlights of the visit, outlines the recommendations, and includes any referrals placed. Second, if you have not signed up already, you will be asked if you'd like to sign up for MyChart, which is our patient communication portal. This is the preferred way to email your clinical team, view your visit summaries, or test results. Lastly, you'll be asked to schedule your next appointment. Sometimes your doctor may suggest returning to clinic in about 6 months, and it's very tempting to call at a later date to schedule. But appointments fill up quickly. We found it better to have the appointment scheduled in advance and make changes if need be versus waiting until the last minute. Now, after your visit, there are a few things to know. You may be prescribed a change or new medication. Our team will send the prescription electronically to your preferred pharmacy. Depending on the medication, it may require a prior authorization, meaning it takes a submission to the insurance from our team with additional information before approval. We will submit this as soon as possible, and the pharmacy will follow up with you once the medication is available. Lastly, if you are referred to other medical services like physical therapy, the after-visit summary will provide contact information for scheduling. If you need any clarification on instructions, please call the clinic so we can address any issues. These are some very common referrals for people receiving care at our center. First, physical and occupational therapy. Now, I believe many people are familiar with physical therapy, which focuses on restoring and improving function, like building strength, improving range of motion, etc. Occupational therapy focuses on engagement, and what I mean by this is an occupational therapist helps his or her clients maintain engagement in their hobbies, work, or activities of daily living. Other common referrals include speech therapy, neuropsychology, which evaluates the function of the brain or cognition, urology, brain imaging, or labs. We also have access to a neuropalliative team, which is an excellent resource for anyone with a long-term neurological disorder. This discipline focuses on maximizing quality of life, symptom management, and future planning. This could be a very beneficial complement to our movement disorders team. Again, when you are referred to any of these services or others at a clinic visit, instructions on how to schedule will be available on the after visit summary. After your visit with us, we'll set up a plan for continuing care. This may involve visits with both the nurse practitioner and your movement disorder specialist. We advise keeping in touch with a primary care provider or PCP like an internal medicine doctor. Although movement disorder specialists manage a wide breadth of areas that may be tied to a neurological disorder, there are times where a question or concern may be better addressed by your PCP. One last thing to note about continuing care. The electronic medical record system that we use allows the UCSD providers to see notes and test results completed within the entire UC Health system. We can sometimes see other health systems records too, like scripts, since they use the same software. If you'd like your UCSD record sent to a provider outside of UCSD, please make that request with our clinic and we can make arrangements. Sometimes a hospital visit will be part of our health journey, and we'd like to be there for you. If you are admitted to the hospital for any reason at UCSD or elsewhere, please notify your movement disorder specialist. We can reach out to the hospital team with the intent of making your care as seamless as possible. Another tool to make a potential hospital stay smooth is to use the Aware and Care Kit provided by the Parkinson's Foundation. This kit may be small, but it is mighty, containing materials to help prepare you for a hospital stay and also educate hospital staff about what your care needs are. To get your free hospital kit or learn more about it, please contact us or bring this up in your next clinic visit. In previous slides, I've mentioned contacting us, so let's cover how exactly to do that. The first option is to send a message from the MyChart patient portal. Please note we have a 72-hour window for MyChart responses. You can also call us at 858-657-8540. Our phones are staffed by our call center team. If they cannot address your question, they will send a message to the appropriate person. Our response window is 48 to 72 hours for phone messages. Sometimes you may have a question that pops up in between clinic visits that is really best addressed in a face-to-face encounter. If this is the case, we'll help arrange an appointment with either the physician or the nurse practitioner. We know there is a whole wide world outside of clinical care, and we still want to be there for you. Let's go over some other resources we offer beyond the clinic walls. First up, education. There's going to be a learning curve with any diagnosis, and we want to help by providing educational resources. First, soak up the time and any opportunity to ask questions in a clinic visit with any of your providers. Second, you can visit our website, and I'll include the link below in the video description. We've curated a list of the best online resources, including a glossary of terms, helpful printable guides to make notes and track habits or patterns, and a list of trusted organizations that are focused on Parkinson's and other related movement disorders. Our center hosts educational events, and you can find information about upcoming events and links to past presentation on our website as well. Community is so important. It offers support and exchange of ideas, experiences, and resources. San Diego has a very involved Parkinson's and related disorders community, so we encourage you to dig in. One mainstay of the community is support groups. UCSD has a network of Parkinson's support groups, and the larger county has many meetings as well. We hope that everyone will seek out a support group just to give it a whirl. It may prove to be an invaluable source of support and education. We can also link you to applicable local organizations like the Parkinson's Association of San Diego and loop you into other relevant activities that are going on. Visit our website or ask to speak with a social worker for more information. Earlier, I touched briefly on the availability of research at UCSD. Most of our movement disorder specialists are involved in research. Most studies take place at our research institute on the La Jolla Hospital campus. If you'd like to learn more about research opportunities, please let us know. One of our research coordinators can help explain the available studies to you. For a complete listing of active studies, you can also visit our website. We are nearing the end of our presentation today, and we've covered a lot of information. We started with an introduction to our team, provided an overview of your clinic visit, shared tips and tricks for making the most of your continuing care, and also covered some educational and community resources. If you have any questions, let's talk and keep in touch. You can find information on our website and also find a link to opt in to our mailing list to stay in the know. I also promised to share my contact information for questions about this presentation, and you'll find that in the description below this video. Finally, thank you for choosing us to participate in your care. It is a true honor, and we look forward to seeing you soon.